In Health News tonight, breakthrough brain surgery for epilepsy patients.
And Yale New Haven Hospital is the only one in the Northeast offering it. News 8's medical reporter Jocelyn Mamenta has this exclusive story tonight. And we want to warn you, though, some of the video is indeed extremely graphic.
It is the end of a long journey and the beginning of a hopeful one for Chelsea Morallo, living with epilepsy since she was 2 years old.
Yep, you're going to go with Lenore right here.
She is in early, prepping for breakthrough brain surgery here at Yale New Haven Hospital. The 22-year-old is among the first to be implanted with a neurostimulator since it was approved by the FDA.
It's been rough. I've been on every medication.
And as she's gotten older, it's getting harder and harder to control it. And so now it's affecting her cognitive ability, it's affecting her speech, and it's just sucking the life out of her.
The standard surgical procedure, not an option for Chelsea, with seizures originating in 2 sites, one on each side of her brain. Neurosurgeon Dr. Jason Gerard.
Temporal lobectomy is a very effective treatment for epilepsy, but you can't have a temporal lobectomy done on both sides of the brain, or this will create a very significant amnesia in patients, so won't be able to form new memories.
Chelsea's only option, a neurostimulator inserted in her brain, which requires intense attention to detail.
It's kind of like a pacemaker for the heart in the sense that it's trying to shock the brain out of having a seizure. So it allows us to treat both sides at the same time.
Doctors rely on the intraoperative MRI several times throughout the procedure to scan the location.
This is going to be on the lateral edge of C3.
Pinpointing the correct placement for the electrodes connected to the stimulator.
You can see that it has 4 metal contacts.
Dr. Dennis Spencer, chair of neurosurgery.
Then the electrode is hooked up to the generator. This is a computer and battery that's responsible for the stimulation and for the detection of a seizure.
The latest option for patients like Chelsea struggling with multiple medications.
Once you've given a patient 2 medications, 2 drugs, and they've failed those drugs, you know that they're not going to respond to any additional medications.
The goal is to reduce the number of seizures and dosage so Chelsea can improve her quality of life.
When she first came, she was, a teenager, very vibrant, outgoing, and she's on 5 seizure medications now, which keep her really kind of heavily sedated and withdrawn most of the time.
I want to be seizure-free.
The surgery from start to finish is about 8 hours, and Chelsea will remain in the hospital for the next few days. I'll keep you posted on her recovery. At Yale New Haven Hospital, Jocelyn Mamenta, News 8.